Come with me as I take you along a Hyperdilute Radiesse treatment for neck laxity and neck rejuvenation. Radiesse is a biostimulatory filler that helps stimulate collagen, elastin, proteoglycans. It just helps strengthen that skin, rebuild the integrity of the skin, and really just give that glowy, healthy skin back, that skin quality. So we're going to do this for this patient's neck. I am going to be using Radiesse at a 1:4 ratio, meaning 1 part Radiesse, 4 parts normal saline, maybe with a little squirt of plain lidocaine. But remember that syringe of Radiesse comes as a 1.5 syringe, so 1.5 times 4 is 6. So I'm adding 6 parts of that diluent to my syringe of Radiesse and really blending it down. Now, it's important to really understand your dilutions. I think this patient could have tolerated a 1:3 dilution, but because she's had a treatment before, I wanted to dilute it a little bit because we're now layering Radiesse on top of Radiesse. So I am utilizing a 25 by 2 inch cannula, and my markings there are to just help guide me to make sure that I place product across the entire neck and I don't miss any spots. But with this product, you'll be able to see some nice threads of that biostimulatory filler as you're laying it, and really you're just painting the neck and making sure that you hit every area of the neck to really give her a full rejuvenation of that skin. So just laying small retrograde threads. When you get to a point where you hit a little bit of resistance like I am right now, you really just take your time. I always tell new injectors when I'm training on cannula that these are the moments I remember when I would feel some anxiety about pushing through too hard. Really, the skin is just made of tons of fibers, and you just gotta, I always look at it as like you're knocking on the door and letting, see right here, I'm hitting a little bit of resistance. I'm just knocking on the door. I'm not being aggressive with my knocks, and I'm just waiting for it to pass through. And if I can't pass through with my cannula, then I'll reorient my position, or sometimes I'll push a little product, and lubing up that area can kind of help glide the cannula. You just got to play it by ear and troubleshoot it as you go, but you're going to hit some resistance when you're using a cannula, and it's totally normal. So now I'm working my way down another thread. I am always placing retrograde threads. I'm never injecting as I'm moving forward. I like to create this like nice pathway all the way down, and then you see me laying a nice thread of Radiesse. I'm always trying to lay these equal threads of filler, and then I like to go in between. Really, like I said, I'm just painting this area so that I'm distributing the Hyperdilute Radiesse evenly. And at this dilution, it's important to know that at a 1:4 dilution, I'm not worried about lumpy bumpies or any product lingering or stiffening up or seeing like threads of like what I call little caterpillars of Radiesse. At a 1:4 dilution, it's a lot of diluent, so it's going to look puffy when they leave, but that's totally expected. It'll blend so beautifully. But if you ever experience a non-inflammatory nodules, which is just a clumping of filler or Radiesse, Alec McCarthy put out this incredible publication where he goes through this algorithmic approach on how to tackle them using subcision and flushing, and it works like a charm. So I'm just redrawing my lines so that I have kind of a pathway yet again, but I wanted to clean that area really quick using my 23 gauge port. Nice little entry. You don't need to enter the whole or insert the whole needle in, and gliding my cannula in. It really should glide in like butter, but again, look, I'm hitting resistance. It doesn't mean I'm doing anything wrong, just means that there's a little fiber there that I need to take my time and let it work its way through. So just always using that smart hand, which is my left hand, pulling counter traction on that skin, and it helps push that cannula nice and through. You can see that left hand is helping hold tension on that skin. And then laying a nice thread, reorienting and going down slightly inferior to that, and laying a nice thread. A nice publication came out recently by Dr. Akash and his team showing that after a 1:1 dilution, a lot of that hardy G prime crashes out. So really at a 1:2, 1:3, 1:4 dilution, you are really only getting that biostimulatory effect and not truly the filler component of it. So that's really, really important to keep in mind, is that yes, it might look full when they leave, but really you've crashed out a lot of that G prime by diluting it as much as we have in this particular video, especially at a 1-to-4 dilution. So I find that there's really no difference between a 1-to-2 dilution and a 1-to-4 dilution based on the studies. And for me, it helps prevent any of those non-inflammatory nodules or that filler kind of stiffening up. So I prefer when the skin is a little thinner to do a 1-to-4 dilution. It'll always just help. So now I'm just filling in the gaps if I see any shadows where I feel like maybe I lacked a little radiesse, and then I see a little deficit here. Really, it's just, again, painting the wall and making sure you hit all those marks, especially where she has those tech neck lines, and then blending out the product beautifully. I'm going to do a little bit of massaging, but any of those little, what you see as threads or strands of filler, they're going to blend out so beautifully. Now, this central line is a line that kind of bothered her, so I wanted to make sure that I targeted it directly. See, I can't find the pilot hole. A little pro tip is when you squeeze the skin to make it bleed a little bit, but you could see I'm struggling there, and that's normal, guys. I mean, we're all human, and I could have trimmed that part out, but I think it's nice to show that I have a hard time finding the hole too. So I found it. I found my porthole, and I'm just working my way through, making sure we obviously know that the thyroid's right here. We have some important structures, but I can see the shape of my cannula, so I am not worried whatsoever about interfering with anything. But this line is a line that bothered her, so I really wanted to make sure that I tackled it for her and laid some nice biostimulatory product directly under that skin. So just working my way through, not rushing anything. This can kind of take some time when you're using a cannula. I have a colleague that likes to use needle for this. I don't know. I find that it's a little less traumatic when you use the cannula. It does take more time, though. I will admit that. So you can see here the filler laid quite nicely. I laid nice even threads throughout the right side of her neck, and now I'm going to work on the left side, and at the end I'm going to do some gentle massaging to make sure it's all blended into the skin. But really, again, I can't stress enough, at a 1-to-4 dilution, I'm really not super concerned about any of those lumpy bumpies. It'll all blend out so beautifully. So now I had already cleaned the left side of her neck. I'm just going to make some markings. I always want to mark that line that bothers her, and then just evenly distribute those lines to make sure that you get a nice kind of equal distribution of that radiesse. There really is no perfect recipe to this. It's really just painting the neck evenly with a little HD radiesse. So a little bolus of lidocaine with epi, same thing at the bottom. And then I'm going to create my little porthole. And now inserting my cannula into that porthole and just working my way down those markings that I made. Knocking on the door, letting those fibers let me in, and you could see where the tip of my cannula is. Always know where the tip of your cannula is, so you know you're not diving deep and you're staying in a nice plane, an even plane. So just trying to get as far as I can, and just evenly painting that neck with radiesse, going in between those markings, going at the marking itself. And you can see it's fairly technically simple. I think the hardest thing is really staying in plane, understanding your dilutions, and just taking your time. I mean, there really isn't anything truly artful about this. It's just technique comes with making sure that you're staying in that plane. So I always know I'm always lifting up my cannula to make sure that I'm not diving deep. But nice even retrograde threads. This side of the neck is definitely giving me less resistance. You could see I'm moving through it a lot faster than the other side, and that'll happen. Doesn't mean I'm doing anything different or wrong. It just means that where I'm perfectly gliding my cannula is some nice clear pathways. And then going in with my cannula again at the bottom, working my way down. I had already made my porthole for this site and just laying nice threads. You see how simple it is, and it's such a powerful treatment for these patients. I typically like to do 2 sessions spaced 4 to 6 weeks apart. I typically do 1 syringe per side. And this is a great treatment for somebody at any age, really. Somebody in their 30s could benefit from this, 40s, 50s, 60s. I mean, I'm probably not performing it on somebody in their 70s or 80s because really that's truly just surgical. But I think it's a great option for patients who are really wanting to keep their neck looking healthy. I mean, remember, neck and hands are the number one signs of, or the number one way we can guess somebody's age, because we really don't perform our skincare or take care of our neck as much as we focus on our face, and our hands are always exposed to that sunlight on that steering wheel, and they're just getting constant beating of UV radiation, so they age significantly. But looking for those deficits, I saw that I found that little deficit. You could see I'm going right into that deficit, making sure that I'm painting everything so beautifully. I see a deficit down below here. You can see the little shadow, so I'm going to work my way down and try to soften that deficit. Letting those fibers let me in. Tap, tap, tap. There we go. And laying a nice thread of filler. You can see it fills up that deficit nicely. Again, I know when I first started, let me tell you, I know that these threads of filler that you can visibly see were concerning to me at first, but once you've done many of these treatments, you know at a 1 to 4 dilution, you're going to be absolutely fine. So now I like to use the scratch mechanism, and I really take my nails and kind of blend all that filler in. What I like to do is pinch the portholes and make sure that I get all of that accumulated radiesse that's sitting right at that porthole, because if you really think about it, you are laying all of these retrograde threads coming close to that porthole every single time. So you get this kind of buildup of radiesse at that porthole. So if you squeeze that little porthole and let a little bit of that radiesse out, then it helps avoid what I call a rice kernel. Because what will happen is a little bit of radiesse will harden because you accumulated so much at that porthole. You could see I'm doing that right now. I pinch it just to make sure that all of that radiesse isn't sitting right in that porthole, because I have had that experience, and once I perform a little bit of subcision and flushing, I'm absolutely fine. But it's annoying to have the patient have to come back with that little rice kernel at the porthole. So to avoid that, I just pinch those little sites, and I've had no problem ever since doing that. But just blending that product in. Typically, I will ask the patient to do some gentle massaging for a few days so that it avoids just any lumpy bumpies in the future. Again, I'm not too concerned about it, but I feel like that little bit of extra massaging helps, and they're not going to hurt the product by massaging it. It's already in there. It's going to start working with those fibroblasts, and everything is going to look absolutely great. But I continuously, you could see, I definitely have run into some of those rice kernels, so I always get so nervous and like to pinch it, but look at how beautifully that lays. It really blends so nicely. Those tech necklines are much softer, but again, a lot of this is diluent, so it'll soften, and that biostimulatory effect will start to take place. Now here's how you know that I'm a perfectionist, because I see a little bit of a deficit after massaging, and I really want to soften that for her. I know it'll blend beautifully, but I just want it to look the absolute best that it possibly can. So I'm taking that last little bit of radiesse and blending in that little deficit so that we don't see that harsh little shadow right there. And again, it's not going to lay that way, but I just like for a clean result. So I'm going to go back in and make sure that I do a great job and do my absolute best for this patient. So just laying little bits of radiesse to soften that deficit, and then I'll blend it out so that it all blends in super nice. See, that looks better already. Always go that extra mile. I always think about a patient, what would I want done for me? And that always helps guide my decision. So I think this result came out absolutely perfect, and I can't wait to see her for her next treatment.